Hi guys, so this is Dr. Vikashini. I'm a general surgeon. So today we're gonna have an open talk about how to tackle this 3 years of surgery PG residence, surgical PG residency. So I would like to share a few practical, simple, and honest insight about how to survive this 3 years of surgical residency. So this 3 years of surgical residency is not just a training period; it's a transformation. So this 3 years will test your physical strength, your mental resilience, your decision making, compassion, your patience, your teamwork, and ultimately, see, you not only grow as a doctor, but you grow as like as a person. You grow, and ultimately these 3 years will prepare you for a lifetime as a surgeon. So now I have categorized today's talk into three topics that has to like with tips to how to approach each year with purpose, because the 3 years will like each year will demand you a different mindset, and also it gives a different lesson. And depending on which institute you have joined, you get exposed to various clinical scenarios. Say, for example, I did my post graduation in Tanjore Medical College, where we have around 15 to 20 bedded surgical ICU. That is inclusive of all specialties, like 3 or 4 beds will be allotted for every specialties like neurosurgery, urology, plastic, vascular, onco, gastro, and even for ortho. And we surgery PGs will be posted twice during our PG tenure, once during the first year and the second time in the second year. So in the first year, we mostly take orders from our seniors and professors. So our job is just to observe and absorb and just execute whatever instructions or like whatever we were instructed to do. Whereas in the second year, the transformation will be evident. That is, your responsibility increases and dependency will reduce. So you start taking own decisions, but still you need like taking into account the orders from our seniors and consultants. You have to keep them informed about the current status and updates, but still you can take independent decisions and keep them updated. That's it. And also you get to perform some new techniques like ICD placement, SPC placement, tracheostomy, and even intubation. All these procedures you'll be doing with more confidence and more gracefully. So now let's start with how to tackle or how to face or approach the first year of residency period. So this year, the first year is all about immersion. That is, you need to immerse yourself in field work, because you get to know the rhythm of surgical life. Like you'll be having endless ward rounds, emergency calls, call overs, ICU monitoring, assisting OT cases, and dressings. And you need to do a lot of dressings and drain removals, minor procedures like secondary suturing, bedside suturing. And you'll be having sleepless nights, and you need to manage the admissions and discharges, even lots of hundreds of small tasks that you feel thankless. But you need to understand that these are the tasks which actually form the backbone of the patient care. So actually this year will teach you, like this first year will teach you all those basic surgical skills. And see, in the hierarchy of this medical profession, the first year PG is actually treated as upgraded intern. You are nothing but an upgraded intern. So you will be asked to take responsibility, own your responsibility. Like if something, whatever goes wrong, even if an intern commits a mistake, you'll be scolded for everything, but you cannot talk back to your seniors or professors. So you have to endure all those things. So you learn to endure things, and with humbleness, so humility, and you'll be disciplined, and you'll also learn how to survive with minimal sleep. And like not all tasks will need your immediate attention, so you have to learn to prioritize the task. So all these things will be taught to you day to day activities. So as a whole, if you feel overwhelmed in the first year, which means that you are doing it right. So the general key tips for the first year is that always keep a notebook or a pocket note, carry it everywhere, and whatever you feel new, or like you need to jot down or write it down, whatever everything you feel new. So whatever you feel that you have learned it new today, just keep a note of it and keep writing everything, so that your future consultant self will thank you a lot. And next general tip to approach your first year is that if you'll be getting a lot of doubts, and don't wait until that doubt becomes a mistake. So soon after doubt appears in your mind, just clarify the doubt as soon as possible, and before it, like don't wait until it becomes a grave mistake. And next is you need to build a strong rapport especially with your co-PGs and staff nurse and all other colleagues, especially with your co-PGs and staff nurse, because most of the time those are the ones who will be saving you. And see, don't think that you're not getting enough chances, something like that. In this unit, I'm being posted in this unit, so I'm not having enough caseload and not getting enough chances. Because see, surgery learning is not going to stop in this 3 years. It's a continuous process. Learning is a continuous process. Every case, be it a simple abscess case or a diabetic food dressing case, like take it as a learning opportunity and do it with full enthusiasm. See, especially to make a note, these dressing cases are the ones you will gain a lot of hands, but like you don't recognize it, but still you develop hands only by doing repeated dressings. So as a whole, like to wind up the first year, so keep a notebook, jot down everything you feel new, and clear your doubts then and there. Don't wait until it becomes a mistake, and build a strong rapport, especially with your colleagues and staff nurse, and address or approach every simple case as a learning opportunity. So don't hesitate to do anything, whatever simple uh, job you a task you have been assigned to, do it with full enthusiasm and full dedication. Now moving on to the second year, so this second year is actually a period of like expansion. That is, this is the year where you expand your horizon, because you'll be rotating through all those specialty postings like plastic surgery, vascular, cardiothoracic, onco, gastro, neurosurgery, or something like that. Like all these postings, you'll be rotating through. So, because these postings will expose you to the branches that actually influence you in like making a decision, surgical decision on day-to-day basis, and also will help you to choose your career wisely. See, like getting exposed to all these various specialties will teach you a new dimension of patient care. So you get to know a lot of modalities to treat a patient. Like in a variety of ways you can like execute your patient care, right? So the key tips that you need to bear in your mind during the second year is that you need to actively participate, like actively scrub in for every case, every possible case. It's not that you need to always perform a surgery. See, a good surgeon will become a good surgeon only by assisting a lot of cases. So even if it, like if you get an opportunity to assist a case, nothing wrong in it. Actively scrub and assist in every possible cases. You get to know a lot of techniques by assisting various surgeons. Got it? And next is, you need to, in the next thing to focus in your second year is that you need to observe how your seniors and professors or consultants, how they are making like making a decision. Because surgery is not only about operating. See, the techniques you can learn anywhere or anytime. Anyone can operate, but only a good surgeon will know when to operate and when not to operate a case, for which you need to get exposed, and you need to work in coordination with your seniors and professors. And you also need to learn from others' mistakes. See, by committing a mistake, you get to learn from all those experiences, because committing a mistake is also an experience, but it is not possible for you as a person to commit all the mistakes, right? You also need to learn from others' mistakes, for which you need to work coordinatively with your seniors and even with your juniors. So mainly focus on decision making. And next thing you need to focus in second year is that you need to enlarge your knowledge in radiology. That is, you need to learn to interpret the imaging, because a surgeon who knows the language of imaging is always one step ahead. And the last and foremost thing in your whole life as a doctor or as a surgeon is that communication. See, communicating clearly, especially with your patients and attenders, and then with your colleagues and your consultants, is very very important. See, delivering a bad news like declaring a death, or saying that the patient has succumbed to a cancer, and for which the patient, he or she might have to undergo a surgery followed by chemotherapy. So delivering such bad news will actually destroy the patient or shatter the patient emotionally. So thereafter, his whole life, the patient's lifestyle would have to change, or the family members' lifestyle have to change accordingly. So always communicate with empathy. So this communication with empathy, it is actually an art that comes only by practice and by observing how your seniors or professors are handling it. So like focus on it and provide a keen attention to that part of this thing also. And also you need to develop a calm and analytical mindset even in the setting of emergencies. You need to develop a calm mindset and also analytical mindset, because only if you're calm, your thought process, you can navigate your thought process in order to make a proper diagnosis or correct narrow down. You can you'll be able to narrow down to a proper diagnosis with how the patient present to you. So on the whole, in the second year, you need to actively scrub, even if it is for assisting a case, not only to perform, even it is for assisting, actively scrub. And decision making when to operate and not to operate is also important. Imaging, radiology, learn to interpret imaging, that is important. Communication is important. Communication, which means delivering a bad news, opening up death or some cancer or severe ailments to a patient, that is important. And you must be calm even in a critical scenario circumstances which pushes or tests your patients. You must remain calm. Only a calm mind can think better. Got it? And next, whatever you have learned so far in first year and second year, everything comes together finally in your third year. So because in third year, see, you almost you know to handle the ward cases, your casualty, your OPD, everything you can single-handedly manage with confidence and grace. And even your consultants will start trusting your operative findings or examination findings and judgment. So this is a year of leadership, because like you also gain your leadership quality. A surgeon is a best in developing all these leadership qualities, isn't it? Because in case of mass casualties, your efficiency depends upon how well and coordinatively you extract work from your subordinates. Your subordinates are nothing but your junior PGs, junior PGs, your interns, and your staff nurse and paramedical health workers and health assistants and other technicians. So all these all of them are your subordinates. So like your efficiency, like how you manage a mass casualty or a busy casualty, is that it depends on how well you extract a coordinated work from all these people. So learning a leadership or developing a leadership quality is must in this third year, and this must be like associated with a balanced, disciplined study time. So in third year, you must focus more on the theory part also, because my professor used to say that, emphasize this point, that once you complete a PG period, you're not going to sit with a book and read. After your PG tenure has got over, you're going to come back to the books only to refer if you have any doubts. That's it. You're not going to sit with a book and build up your fundamentals right from the scratch. But it is only during the PG period you get you're like out of compulsion or out of interest, you get time to sit with the textbook and read from the basics and build your fundamentals. But soon after your PG period, you just refer books, either to clarify doubts or to learn a new technique or to learn a new skill or something like that. So always focus or spare time for the dedicated study time must be there in your timetable of your third year PG. So along with the leadership qualities, theory part is also very important. See, there is something my professor, this is actually my professor used to emphasize, and during my final year period, he actually started a routine. My professor actually started a routine that he used to insist us to write down a topic that we read every day in a diary, along with the reference book, the name of the book, what topic we have read from which book, along with the edition, the volume, and page number. Because in future, if we want to enhance our knowledge on particular topic, now we can easily navigate with the help of this reference, isn't it? So, and this diary where we write the topic we have read every day, this we have to get it signed from him on every OPD days. So this actually compelled each one of us in our unit, my co-PGs, my junior PGs, everyone, we were compelled to visit library on everyday basis. So even on duty days, we used to visit library, and at least we'll spare time to read, like at least on half an hour, at least we'll read and jot it down and get it signed from him. So this actually was encouraging as well. So we get a feel that we are under supervision, we are being guided in a right direction. So see, that is a common saying that physicians have to read a lot. Surgeons, they don't have to read; they just have to practice some surgical techniques and they get skilled. That's it. But what happens if the surgeon also starts gaining a theoretical knowledge? If they start read, because there are lots to read actually. It's nothing like surgeons don't have to read. What if a surgeon gets clinical skills? And hand in hand with if the surgeon is also strong in the theory part, then he becomes a very good clinician as well, right? Apart from becoming a good surgeon, he becomes a good clinician as well, and that's very important. In diagnosis, see, diagnosis is not only made by the physician. Even we surgeons have to make decisions, right? Whether to operate, whether to not operate, whether to wait. So all this have to be done by the surgeons as well. So this theory and clinical skills, they must grow hand in hand. So erase all those common sayings that physicians have to read a lot, Harrison book is biggest book and something like that. We surgeons also have to read a lot. So the theory and the clinical skills, they must grow hand in hand. Now in this at this point of time, I would like to quote a few experiences from like personal experiences which I underwent when I was in my final year postgrad when I was a final year postgraduate. So during one of my evening rounds in the casualty. So one of my duty days, I went for evening rounds in casualty, and one of my junior PG was presenting a case to me, and the history was very as simple as like this. Like a 40-year-old female, she was like she came to the casualty with abdomen pain, with shock. That is, her initial BP was somewhere around 80/50. So they resuscitated her with IV fluids, and her BP picked up. That is improved to 110/60. That's it. That's all he presented. But and also it was a government college, so there was no inadequate bed in the triage. So she was made to lie on the floor. See, always not all abdomen case will present with shock. If there is a shock, then it's not as simple like this, right? There must be some other reason behind the shock, which see this resuscitating with fluid. The treatment doesn't stop here. You need to identify the root cause. Until you find out the cause, the treatment is not over. You just have resuscitated. You have not treated. The management is not yet over. So after giving nice scoldings to my junior, I assigned her a bed and ordered for a CT abdomen, and that showed a free fluid. So this is the importance of learning some knowledge, some basic findings you must be able to pick up from the CT without the help of radiologist. So that time you can't wait for a radiologist to come and give you a provisional report. So you must be able to pick up some basic findings like pneumoperitoneum, hemoperitoneum, free fluid, air. Or some growth or some emergency, at least some basic things you must be able to pick up. So that's the importance of knowing the language of radiology, which I mentioned it during like how to approach the second year. So that CT showed some free fluid. So immediately this was intimated to the duty assistant, and she was shifted to OT. And the improper finding was a segment of the ileum was twisted. There was knotting of the ileum, and the closed loop almost went for obstruction and gangrene. So we had to then perform a resection and anastomosis, and thus the patient was saved from other worse outcomes. So thus this case went like this. Again, similarly, on another duty, my another junior PG, she was a first year junior PG. She also presented a similar case with abdomen pain and shock, but this time the shock was not. Like the her BP didn't pick up with the fluid, like crystalloid resuscitation. So what they did was, upon routine investigation, her hemoglobin was somewhere around 6 or 7. So they also ordered PRBC, packed RBC. And when by the time when I came to OP, so I was not informed about all this scenarios. I was not informed. Just in time when I came for evening rounds, they just presented to me that this is so and so case with abdomen pain and shock, whose BP didn't pick up with fluid. So we started on blood. So this was the like this it went. The presentation went. Again, like a blunder was made. Now this time, what could be the blunder was that they failed. They failed to collect her past history. So upon inquiring her past history, she gave us all her old medical records in which she had already underwent CECT, contrast CT abdomen, like some 6 months ago, and that showed an exophytic growth, probably a cyst that's been arising from the jejunum with feeding vessel from aorta. Now, this solved the mystery of the case. So, she was complaining to me that the patient's BP didn't pick up even after resuscitation, ma'am. So, we started transfusion. Now, it's second blood on flow. See, there's like the scenario is incomplete, right? Now, upon inquiring her past history, this completes the cycle and the case mystery is being solved. Yes, probably that exophytic growth would have ruptured, or the feeding vessel, which directly arising from the aorta, would have ruptured. So that there was an exophytic growth with feeding vessel arising from aorta. So the feeder vessel is from the aorta. Any blade from aorta can never be stopped. How can a BP pick up with just resuscitation, and even with blood? How can a BP improve? It's so fishy, right? It's rubbish. Again, I gave nice scoldings, and immediately the duty assistant was intimated, and with the vascular surgeon backup, we again took up the patient for like OT, emergency OT, and the case went on the whole night. And thus, the patient, fortunately, the patient was saved. See, what I mean to say here is that we need not perform very complicated. We need not know to perform a complicated surgery. But what is more important is that you need to know when to refer the patient, or you need to refer the patient at the right time to the right person. That clinical knowledge only you need to earn during your PG residency. Got it? So from then on, no, even before those in these scenarios had happened, I used to give a general advice to my juniors that please keep in your mind that every case you see in casualty, they are going to die. So keeping this in your mind, please rule out all the worst scenarios first, because if you skip from this alertness, then it will cost you a life, isn't it? So don't skip from your alertness. Always keep your curiosity alive. Always ask questions like how and why the BP didn't pick up, or why in the first place, why the patient presented with shock. So curiosities like that must be kept alive, because it might cost you a life, and that's very precious, right? So that is also a part of negligence. Got it? So, and never consider any case as a simple case in the first place. Consider every case is going to die. So, rule out all the worst scenarios. This is the basic learning that you all have to bear in your mind. Even in the OPD, if some patient complains to you of headache, the immediate thing that should occur to you is that it could be a thunderclap headache. As a surgeon, like as a physician, there can be a lot of causes for headache, but as a surgeon, your thought process must be like this. Like it could be a thunderclap headache, which will happen in a subdural hemorrhage STH. So you need to ask for trauma history in the past 2 to 3 weeks. Got it? Because we are not common man. So like your doctors, especially surgeons, brain is trained in that way, because the common things, more than the common things, all this your focus must always be in eliminating the worst scenarios. So your brain must be wired in such a way. That's why you're going through all this strenuous residency period. So not to think in a common way. So we are not a common man to think like that. A common man might think it's nothing, a simple headache, it's nothing, a simple abdomen pain. But a doctor should not think in that way. Got it? So keep your curiosity alive and ask why and how, like questions like why and how, on for every case on everyday basis. Even one day you skip, you might lose one life. So be alert every time. Now, like on the whole, like we have like I have given you the key tips. These are just only key tips and tricks like as to how to approach the first year, second year, and third. So first year full of field work. Just carry on whatever you're instructed to do, and just observe and absorb whatever been assigned, whatever the task has been assigned. Second year, it's about communication skills. You rotate through the specialty postings, so you grow as your horizon will grow. Your treatment modalities, you get to know various treatment modalities, communication skill, radiology. All these things have to be focused in second year. Third year is leadership, earning a leadership quality, along with a dedicated a disciplined study time must be spared along with your duty time, sir. So next, on the whole, what are the general tips for you to like cultivate is that, see, during your PG residency period, don't worry that, yeah, as I already mentioned, don't worry that you're not getting enough chances in your unit or in your institution. There's no high volume cases or something like that. See, basic skills alone must you need to focus, because most of the you gain your hands by doing a lot of dressings, as I already said. So do a lot of dressings and gain your hands. But that is a very underestimated point. How can you gain hands by doing just dressing? But yes, it is true that you gain hands by doing repeated dressings. And one more thing, what is important is that it's not important that you need to learn 1,000 techniques, but you need to do one technique 1,000 times to get well versed in that. Got it? So basic skills must be learned, and don't worry about not getting enough chances, because surgery is not going to stop in this 3 years. Down the lane, you're going to learn anyway. You're going to learn the new techniques, and with the rapid growth in the new technologies, the new techniques they keep emerging, and one cannot master all the new techniques within a stipulated time. So learning is actually a continuous process. But whatever is the things that so far I mentioned, with like in the first year this is important, second year, third year, whatever things I have mentioned so far, that is only important in shaping your decision making, your thought process, your compassion, the basics. These are the ones that have to be learned under supervision. Other things can be learned once the basic skills are learned. Other things you'll manage to learn on your own. And see, you have to learn from the others' mistakes also. Got it? And finally, last but not least, the foremost is take care of your physical health and your mental health. See, please open up to whomever you feel comfortable, and never let your exhaustion affect the kindness and patient care. And yes, keep your curiosity alive. Ask how and why questions every day. And please remember, residency is hard. Whatever branch, whatever field you take, not only surgery, but surgery is a bit exhausting, physically also exhausting. You need to stand in OTs for hours and hours together. So keep in your mind that residency is hard. But some days, yeah, some days will break you, some days will like build you, and some days actually remind you like as to why you chose surgery in the first place. See, but once you finish the 3 years of residency and you come out, you just not come out with a degree, but you come out as like with confidence, with character, and with compassion. So the skills whichever you have learned, or the discipline you have gained, or the lives you have touched, these all actually become the true certification. It's not only just degree. Now, all this will like discipline, the skill, and the lives you have touched. All this will become your true certification. So I hope this session was very useful. Thank you all. All the very best for your PG residency. Thank you.